have contracted COVID-19. So you're told you're positive. What are some of the thoughts that people have right away from your experience dealing with persons?
So dealing with persons, one of the first things is I have COVID-19. Oh my gosh, where do I go from here? So people have a level of uncertainty because it's not necessarily I have COVID-19 and then I can get medication, stay home for a while, and I get better. You have to give COVID-19 the opportunity to work through your system, and then you are retested within 2 weeks. So at home for this 2 weeks, we have a 2 week period in which we are at home with our thoughts. And this
Stresses.
is where things can go left because people start stressing out. And when you sit down and you focus too much on any one thing, you kind of make it worse in your mind. So you start thinking, what if I get ill? What if I gave it to other persons? Because when you go and get tested, what they also do is contact tracing, meaning they ask you for a list of people who you would have come into contact with. So now you're worrying. What if I gave friends, family, co-workers COVID-19? And that is one of the main things that we're seeing is a lot of people are worrying about what next. So what we're encouraging persons one step at a time. When it comes to COVID-19, nobody wants to get it. Nobody wants to give it to anybody else. But we are at a place right now where people are contracting it. So one step at a time. You get diagnosed with COVID-19. You give your contact tracing list. Okay, then it is up from there to decide where do we go from here. You can decide I'm going to worry, or I am going to come up with a plan on how I'm going to move forward for the next 2-3 weeks until I'm tested out negative.
Okay. So, right. Just stay right there. All right. So, what are some of you mentioned? Okay, so I might start to worry about, and you didn't mention. Well, you said you might start to worry about who you might give it to, right? But you are alone. You are away from your children. You're away from your family. You're away from your favorite people, your coworkers, parents, and so on. And a little later on, I want you to touch on children in quarantine. What are some of the things you said? Take it one step at a time. So, realistically speaking, I'm sitting there and I'm worrying, and I just cannot stop worrying. And I'm supposed to take it one step at a time, but I just can't. What next?
And that's understandable. So you get into quarantine. What are you going to do in quarantine? Because oftentimes we don't come up for a plan for things. We kind of just go through the motions as it comes. So what I'm going to encourage persons to do, and something that we've tried to do beforehand, think about if you were to get COVID-19, what are you going to do in quarantine? Technology has allowed us, if we have those devices, that we can do many things. You can watch things, you can stay in communication with friends and family. There are lots of different things that you can do as opposed to just sitting down there and worrying. You can go on YouTube, find YouTube exercises. You can watch a rom-com, a sitcom, something that is funny and enlightening. Because oftentimes we get diagnosed and all of a sudden we're on the device trying to figure out who would have had this, how many people died, what is the worst thing that potentially happened, instead of thinking, what are some positive things that I can engage in while I am in quarantine? Planning for after quarantine, that's a good thing as well. Planning and deciding, where do I go from here?
Okay. All right. So some other coping mechanisms that persons can practice or try to do while in quarantine. Watch something funny. But what about if you have children? All right. What if you have children who are away from you? What do you do then? Like how do you stay sane, quote unquote, during that period of time, and how do you maneuver, either stay connected with your children while in quarantine?
It is my hope in life that people have somebody that they can trust and engage with who can keep their children. But in all honesty, that is not going to be the reality. If you are in a house with your children and you realize, okay, I have nowhere to send my children, then from here you are to be as careful as possible. So you are to, one, try to minimize how much you engage with your children as much as possible. Any services that you are going to be sharing, They should be sanitized quite frequently. And any engagement, you should be wearing a mask and try to be as physically distant as possible in that instant. Because we know in all reality, when we are put on that 2 week quarantine, we may not necessarily be able to say, okay, children, you have to go by granny for 2 weeks. The reality might be, okay, it's just me and my children, I have nobody else. Explain to your children what is happening, and I am encouraging you to do it in a child-friendly manner. So
Oh,
don't
so
go and
break it
say,
down.
mommy has COVID and now she has to put protocols in place, because these are the things that are going to confuse a child. Because first of all, they might be like, protocols, what is she talking about? So, breaking it down as much as possible. Mommy is suffering from this, daddy is suffering from this, and she's going to have to stay away from you for a little bit. We're still going to be in the same house, and try and figure out what are some things that you can do to keep your child active and engaged. So, if you have the abilities to put on their favorite show, work that you can give them to do, stuff to keep them engaged by themselves for as much as possible as you can. Try to figure out what is going to be the situation with meals. How are you going to prepare the meals in a manner that is as safe as possible? And if you have friends and family that you do trust, I'm asking that you reach out for help. Reach out for help and assistance in that instance.
All right. So good stuff. Good stuff. Now, what if the child is the one who's in quarantine?
So if your
All right.
if your child is in quarantine, yes, you still have that conversation with them about what is happening with them. Explain to them why they have to spend time by themselves.
For
And
two
then
whole weeks, you have your child in
that's
quarantine
difficult.
for
That
2 whole
is
weeks.
difficult.
All right.
And find ways to keep them engaged. So what you can do is plan a schedule. What I had somebody do, they wrote up a schedule on their wall. And they outlined what it is that they should engage in at one particular time. And this is not to say that they didn't engage with their children, but just to give the child some level of structure as to what it is they're going to do today. Because we want them to have as comfortable a time as possible. So making time for them to study, because at the end of the day, they still have to study. Making time to watch their favorite show, making time for them to rest, and just monitoring them on how they are doing.
All right. And at this point, we'll welcome Miss Shunnell Nedd. She is a social worker within the Ministry of Health, Wellness, and the Environment. Good morning and welcome to the Wake Up Call. Sorry. Let's go again.
Good morning.
Okay, good. Didn't realize it was already on. All right. So welcome. And we are discussing this morning coping with COVID-19. You're a social worker. Have you had experience with, speaking to and interacting with COVID-19 patients? What has that been like?
So yes, I have. We are also a part of the psychosocial team for COVID. And so because of that, we would have had to check in with persons, especially earlier up, and, call in, check in, make sure they were doing okay, make sure they were feeling well. I think for me, it was very difficult because this is new. We don't know anything about this. And to try to walk somebody through COVID-19 and it's new and we don't know anything. We don't really know that much.
Yeah.
It was really difficult. A lot of persons would have had anxiety and depression, and I couldn't go to them face to face and say, okay, this is what we're going to do. We had to use the phone and try to calm them down in that way. So it was difficult, but we are getting better as we go.
Okay. And the responses of persons, were they receptive to the information? How have they been responding to when you are speaking with them?
Most persons have been very responsive. They are very thankful. Most people are happy that somebody is willing to take the time to check in and make sure that they're all right.
Okay. Ellica, have you been doing the same thing as well, like calling?
Yes, we are both a part of the psychosocial team on the task force. So it is about 4 or 5 of us that would have been doing it. Most people were receptive. Sometimes you get that one difficult person. What are you calling me for? But
Really?
yeah. But
Wow.
outside of that, persons were just happy that somebody was checking in that instance. We did have situations where we had to deal with actual psychiatric problems. So persons with depression, because that is something that can develop when persons are in quarantine. And it's something that's going to come up, which is another thing we want to do. Tell persons when you're in quarantine, pay attention to the signs and symptoms. So if you're feeling depressed, if you're feeling overly anxious, and for one, if you start experiencing suicidal ideation, because it can be frustrating, and sending people into quarantine, sometimes we realize that they would have had pre-existing mental health issues that are further exacerbated by them being in quarantine. So making sure that people get the assessment. If you know you have family members who need that assessment, making sure that you reach out to respective bodies and say, okay, X, Y, and Z is in quarantine. They're not doing well. We're asking, where can we get help in this instance? How can we get a doctor to them? How can we get somebody to speak to them via the phone? Because these services are available.
Okay. So we have 940 positive cases. How do you guys keep up? It's five of you. How do you keep up with so many people?
Well, we had to break it down. So for now, it is given to persons who ask for that intervention, because all 5 of us still have our regular government jobs that we have to do.
Ooh.
So we still have to go back to mental health, still have to go back to Nemo ID clinic, all of these things. So it is a service that is available upon request, because in reality, keeping up with all of these people, it is difficult.
Yeah. So could you give a figure like how many people have requested so far? Or
don't
actively requested, or you just
have
get a
a
number
figure
and like,
off the
hello.
top of my head
Okay.
now.
Okay. So it has to be requested, right? At the end, we will get to some contact information, how people can get access to this sort of service. I want to ask, based on your interactions with persons, most people are female or male?
We've had a mixture of both, actually.
Mixture?
Yeah,
it
it has
has
been a
been a
mixture.
quite standard mixture
Okay.
of both persons.
Because as you mentioned, requests, I know that there's a stigma attached to mental health, and men, they are less likely to really come forward and either request it or say that there is a problem. So in terms of your interactions as well, have you been able to, you said some people might have some pre-existing conditions. In terms of the positives coming out of this, have you been able to either diagnose or treat other things besides coping with the depression and the anxiety of COVID-19? And how successful has that been?
Treat as in mental health related or
Mental
physical?
mental health related, yeah.
Most of what we seen was related to depression and anxiety. I think probably 2 or 3 psychotic issues, but they weren't that large. It was mostly surrounding depression.
Yeah.
Okay.
And what would happen as well, nurses would give us the information as well, because that would be their first level of contact. So if nurses spoke with them, assessed them, and felt like they needed that intervention, they too pass on that information.
Okay. So, as mentioned before, there would be some people who are not directly affected. Maybe, Ms. Nedd, you can expand on this, like persons within the home, and how should they cope, or what should they look out for, and how can they lend support to persons who have been tested positive for COVID-19?
All right. So the things that we want them to look out for, some of the things, I think at this point it's to help persons try to cope going through this. So allow the person to talk. So just give them that free space that they could speak to you, they could tell you what is going on and how they're feeling on the inside. I think a lot of people don't like to talk. We like to handle things on our own, but a lot of times if we talk to somebody, it helps with alleviating the anxiety and figuring out what is going on within my own head. Taking care of yourself. We want them to eat properly. We want them to sleep well, and we want them to drink a lot of water. A lot of persons don't sleep.
I could imagine if I contracted COVID-19. I'm not bored. This is it does not bored. I'm not bored, All right. And I mean, I know like for parents as well, I don't think I'll be sleeping.
Right. So a lot of persons don't sleep well, and we're supposed to get 6 to 8 hours of sleep every day. Some of us function on 6. Some of us function differently. But we are asking for persons to sleep. Try to get that sleep. Stick to your regular programming. Don't stay up all night because you know you're on quarantine, and then in the morning you're groggy. So try as much as possible to stick to your regular schedule.
Okay. So all you hear that? If you know you're in quarantine, go to bed.
Right. So stay connected to friends and family. You're now in a quarantine. You're now in quarantine. And a lot of persons live alone. We want you to
Well, they probably in
use
quarantine
social
long
media.
before that.
We want you to use the social media and stay connected with your family. It's always good to have support.
Right.
We want you to limit your exposure to the news and to social media and all the negativity.
Except extreme.
Except
We
extreme.
positive over here.
Right? But that negative news, like there's a lot of stuff that is going around, a lot of things that are being said, misinformation, disinformation. So what we want is for persons to, limit that. I'm not saying not to use it at all, but don't go off on it. Right?
Okay.
Maintain.
Don't take it on.
Don't take it on.
I heard.
Maintain a realistic mindset. So I'm at home. I'm going to make goals, achievable goals. So today I might exercise for 30 minutes, or I might read 10 to 15 pages of a book. Right? Making goals that I know I could actually achieve. Right?
You don't want to frustrate yourself. Today, I'm going to read an entire
yourself.
book. And you only reach the introduction.
Take it one day at a time, one task at a time. Avoid using drugs and alcohol as a coping mechanism. And that is something that we have to talk about. Because one of the things that we're realizing is that a lot of persons, we are home now, and the bottle of wine is there. And instead of drinking the one glass, we're drinking the entire bottle.
We chug the entire bottle.
No. Right?
Because one, we bored. Two, we trying to cope.
Yeah, but we don't
I'm
want
not
you to
guilty.
do that. No, we don't want you to do that. All right? Do activities that you enjoy. So exercise, yoga, and these are things you can do on your own. Pick up a hobby. If you don't have a hobby and you're in quarantine, now's a good time to start one. Learn to knit. I can't, but I'm hopeful other people will try to learn. Right?
That's true.
And if you feel like you're becoming overwhelmed, we want you to reach out to the professional help that is available.
Okay. So we have a call. Let's take this call. Hello, good morning.
Good morning, Crystal. First time on the program.
Oh, welcome. Happy to have you on the inside. What's up?
I live in the mountain, right? And I just work very hard. So nighttime, when I'm sleeping, I just lay wetting my pillow, sweat. We cook as that.
Professionals, he's sweating at night. So it's either the place real hot.
Real hot. It is
It is
hot.
hot. It is hot.
But
Or
what we have encouraged persons to do is to make sure that you're getting checked up on your physical as well, because it's not always signs of mental health issues.
And nighttime, I just all get up and drink a lot of water and then start to sweat.
Okay, could be your body excreting all the water that you consume.
Yeah.
Are you experiencing any feelings of anxiety, any overall sadness? Not
Well,
being
I
able
will see you halfway. I will see you halfway to get the answer because my credit is almost finished.
All
Okay, no
right.
problem.
all right, thank you so much. All right, so
Okay, so sweating a lot at night
Oh,
and you
that's
drink a
interesting.
lot of water, it could be just your body getting rid of that
The
additional
toxins.
water. And right now, it is very hot. To me, at night right now, I'm sweating as well.
Yeah.
okay.
But things to pay attention to, anxious feelings. That is something that can come as a result of being overly anxious, as well as the body's physical way of dealing with it in that instance. So anxious thoughts, worrying a lot, things like these you can pay attention to. If you are fairly still functioning on a day-to-day basis and it's sweat that is not keeping you up at night, let's say there is something on your mind that is holding you and it's just sweating, you wipe it off or you get some breeze and you are feeling better, then it is something that you should worry about.
Okay. So that was interesting. And would that also happen to persons who are COVID-19 positive? You're just like sweating because you're so anxious.
If they have a
Can-
fever,
if they have a fever.
that can happen as well.
Okay, that could happen. So it's more than one things to consider there. Okay, rather interesting. So for persons who are interested in having that professional to talk to, how do they go about doing that?
Okay, so there are multiple ways that they can go about doing that. They can reach out to the Mental Health Rehabilitation Center at 458-4240 or 458-6185. I would leave a number, the numbers with Crystal because it's quite a few. You can also,
Okay. So you could WhatsApp them to me and I could share it a little bit later.
we can also reach out to the COVID hotline at 534-4325. In addition, we have tried to make ourselves more accessible as well. So we do have a WhatsApp hotline that you can call into. We had it for COVID before, and we had it in addition as well for psychosocial support and mental health when the volcano would have erupted. So it's 4 different numbers: 433-9699, 433-9742, 433-9736, and 433-9675, and those are by WhatsApp.
Okay. Ooh, WhatsApp. Yes.
Because we know people are inside and the credit may not be as much.
Yes.
So we try to find a different avenue in which
Ways
people
to
can
reach them.
access the care that they would need.
All right. Okay. So there are about 1 or 2 more questions that I would love to ask you. But at this time, I think we're going to take a break. All right. So thank you for those who joined us live on Facebook at Extreme 104 SVG. I click that